Is Dr. Mike wrong about Prenuvo? That question's been in my mind since I watched his interview with Andrew Lacey, the CEO of Prenuvo. As a practicing physician, I'm all about exercising caution in healthcare. But I also see how Dr. Mike's stance could lean towards paternalism, basically telling people that they may be too anxious to handle certain info. So in this video, I'm going to explore whether he really is missing some key points about Prenuvo. So I actually got the Prenuvo whole body MRI myself, and I discovered a hidden condition that's changed how I train and lift weights. So here's what we'll cover. First, why did I decide to get a Prenuvo scan? And what was my personal experience with the scan? It was honestly a 10 out of 10, and I'll tell you more about that. Next, what the scan found, my hidden condition, and how it impacts my daily routine. Additionally, where I think Mike's skepticism may overlook some crucial nuance. And lastly, this idea of balancing false positives versus the huge potential benefits of catching issues early on. So let's jump in and see if Dr. Mike truly got Prenuvo wrong, or if there's more nuance to this than meets the eye. Before we dive into the criticisms and science, let's talk about how my appointment went. Because I see a lot of YouTube videos on Prenuvo focusing on the experience and facility, and frankly, I see why. So I booked my scan and I showed up at the facility. It was generally warm and welcoming. It wasn't that cold clinical vibe that you get at a lot of other, healthcare facilities or imaging centers. They gave me a quick rundown, and then I got to watch Seinfeld on Netflix during the scan, which was awesome. So the whole process for the scan itself took about 50 minutes or so, but it honestly flew by because I got so into the show. I actually even fell asleep during part of the MRI, and I've had other MRIs before. I've never fallen asleep. And the tech told me that that's a pretty common experience for them at Prenuvo, given how they really try to create this, comfortable environment and with the ability to watch television. So overall, I'd rate the experience a 10 out of 10. And I'm not just saying that. If you've seen other scans, they can be uncomfortable, they require sedation. This one was smooth. Another thing, the follow-up. So after getting your images, they set you up with an NP or nurse practitioner. So first they send you a report, and then you get a message to schedule a follow-up call with a nurse practitioner if you want to discuss the results. Things were a little bit different for me because I'm a practicing physician, so I was able to navigate some of the findings, but they are there to really help you walk through any of these incidental findings without making you panic. So from a purely patient-facing standpoint, Prenuvo nails it. Now, many YouTubers have talked about this angle. My angle today is to get more into the science and Dr. Mike's criticisms. So let's pivot to why I got scanned in the first place. So initially, I just planned on doing this simple video. Hey, here's my Prenuvo scan. Here's what happened. Here's what I found. But then I watched Dr. Mike's interview with Andrew Lacey and realized that there's a bigger story around these new screening tools, the potential paternalism, and whether people should have access to in-depth data about their body, even if it may cause anxiety. Again, I'm a practicing doctor and I believe in firsthand experience. If I'm going to comment on a test, at least one that's being used for preventative medicine, I want to know how it actually works, both physically and emotionally. So I signed up for the scan, and boy, I discovered way more than I expected. Okay, so let's talk about what my Prenuvo scan found. So the big reveal for me was that I have something called partial ankylosis at my C3 and C4 vertebrae. I do weightlifting and jiu-jitsu, and both of these can put a lot of pressure on the neck. Finding out my vertebrae are partially fused changes how I approach certain moves and exercises. I'm not quitting, I'm just adapting. It's safer now because I know exactly what's going on in my spine. The next was some mild scoliosis. So I've suspected something before, but the MRI confirmed it. Now I'm focusing on back and core strength to avoid chronic pain. Again, knowledge is power. And lastly, an umbilical hernia. So I discovered a hernia while doing deadlifts. The MRI just confirmed the size and location. Not a major worry, but something good to have on record. I call that partial ankylosis my hidden condition because I had zero symptoms. Imagine if I'd never known and continued heavy overhead lifts or let my neck get cranked in jiu-jitsu. That's where I think the value is. Now, let's relate it to Dr. Mike's concerns. So Dr. Mike presented a few main points when talking with Andrew Lacey. Let's tackle them one by one. So first, there's the lack of long-term mortality data. So Dr. Mike basically says, look, there's no 30-year study showing that whole body MRI saves lives. And that's true. But mammograms took decades to establish the mortality benefits, despite early controversies about overdiagnosis. The Swedish two-county trial eventually helped solidify their role. Additionally, low-dose CT or LDCT was questioned until the NLST trial was published in the New England Journal of Medicine in 2011. It showed a 20% reduction in lung cancer deaths for high-risk smokers. And lastly, coronary artery calcium scoring was once labeled experimental, but studies like MESA and further JACC research validated its predictive power. And I think Andrew Lacey put it well when he said, If we wait 20 or 30 years for perfect data, we deny people who could benefit now. That doesn't mean we just ignore caution. It means we balance real world use and ongoing research, just like we've done with every other screening tool. Now, next, what about incidental findings in anxiety? So, Dr. Mike explicitly mentions I worry about fueling more anxiety in an already anxious population. On its face, that's a valid concern. Health anxiety can be crippling for some. But if we say, let's not let people see inside their bodies because they can't handle it, that slides into paternalism. Essentially, patients are like children who will freak out if they see a minor issue. Studies like a 2018 British Medical Journal review showed that incidental findings, aka incidentalomas, happen in all imaging. The real solution is good counseling and risk stratification, which Andrew Lacey says they do at Prenuvo. And I'm going to quote him here. He said, "We don't want every tiny finding to lead to surgery. We interpret them with caution." For me, discovering partial ankylosis reduced my anxiety because now I work out smarter. That's the opposite of being paralyzed by fear. So, what about cost and accessibility? Yeah, $2,500 is a lot for a scan. And Dr. Mike sees it as a luxury test, which is a fair point. New medical tech often starts expensive, but over time, if the data supports it, maybe insurance jumps on board or prices fall. Also, Andrew Lacey never claims it replaces colonoscopies or mammograms. He says we see it as an adjunct, not a magic bullet. And that's an honest stance. If you can afford it and you want an in-depth look, here it is. If not, standard screenings still exist. This isn't some underhanded marketing trick. It's an option for those who value more comprehensive info. And let's circle back to my own hidden condition. C3, C4 ankylosis is real. I might have gone years without knowing and ended up with a severe neck injury from jiu-jitsu or heavy military presses. Now I can still enjoy my hobbies just with modifications. That's not fueling anxiety, that's preventing a potential ER trip down the line. I don't see how that's a bad thing if it's properly explained. This entire discussion reflects a core tension in medicine. On the one hand, you have paternalism, which is basically like saying you're better off not knowing, it might freak you out. On the other hand, we need to balance that with patient autonomy. Here's info about your body, let's walk through it together responsibly. Dr. Mike raises legitimate concerns about costs, false positives, and limited data. However, this stance can feel like it's underestimating people's ability to handle nuanced findings with proper support. Andrew Lacey's approach, disclaimers and thoughtful follow-up, and a nurse practitioner consult for those who want it, that's more about trusting people to make informed decisions, as long as they have a qualified professional to help interpret the results. I personally align with the second view. But if you prefer to wait for decades of data, that's your choice. But for me, discovering my partial ankylosis definitely made a difference. So is Dr. Mike wrong about Prenuvo? So wrong may be a little bit harsh. And he's valid in exercising caution, particularly when it comes to overdiagnosis as well as the cost. But I do believe he undersells just how empowering these scans can be, especially when done with proper counseling. My own hidden condition literally shifted how I train, which should help to prevent from a potential injury in the future. That's a win in my book. If you found this video helpful, hit like and subscribe. And let me know, do you side with Dr. Mike's approach, or do you favor more comprehensive testing? And have you considered a whole body MRI for yourself? I'm Dr. Nick. Thank you so much for watching. Stay curious, stay healthy, and we'll see you in the next one. Thank you.